Hi, it's Dr. Noel Williams, COVID update, October 19th, 2020, Optimal Health Associates, Oklahoma City, Oklahoma. Had a few days off just doing lots of gardening, planting bulbs, doing all the stuff you do with COVID going on, staying at home and working around the house. So got that done. Now I think the next few days we're going to be pretty steady with the updates, as there's some science updates I'll give during the week. And then statistically, things are beginning to definitely show the second wave is here. The summer thing was not a second wave. That was just a continuation of the first wave, in my opinion. This is the real second wave, which we've been expecting. And unfortunately, it's going the way that I think I had a little level of denial about, even though intellectually I thought this was going to happen, but it really is occurring. We had 53,000 cases in the United States yesterday, 700 and some in Oklahoma. In the United States, we're just shy of about 8.5 million. In Oklahoma, about 109,000. Deaths in Oklahoma are about 1,180 or so. Deaths in the United States are approaching 220,000. The world numbers, about 40 million people have been infected. Roughly a million plus have died. I'm not following the world numbers as much, but I can these days. But I can tell you it's escalating everywhere. And so when you look at what the World Health Organization is saying, which again, those of you who have been listening to me, I don't have very much respect for a variety of reasons, all based on science, is that they're saying, no, we just really need to ratchet down on the quarantines. Well, it's a little late for that. Everyone knew who had a brain in public health that there would be quarantine fatigue, and we needed to have a better plan. The whole reason we quarantined in the first place was to develop mitigation strategies for the virus. It wasn't to be in a permanent 2-year quarantine state or a 1.5-year quarantine state. That was not the purpose of quarantining. That's not a viable public health strategy. It was to learn. So that's what I'm going to talk about. What have we learned, even though none of the public entities are giving us that, which drives me insane, but it is what it is. Because neither the FDA has learned or provided any structure, or the CDC. And this isn't going to turn into a wine session, but I'm saying the purpose of the mitigation strategy at the beginning was not to just do a mitigation strategy for 2 years. That is not good public health strategy. I want to be very clear on that. It's crappy public health strategy. It doesn't work. It would have never worked. I think it's just beyond stupid to say, no, we need to quarantine all over again. We have to take what we learned. So what did we learn? Well, we learned that COVID is a complex viral illness. It causes both inflammation, and that inflammation can lead to thrombosis and thromboemboli, or little clots. And it's a whole body potential inflammation. And then secondarily, we've also learned that it has an asthma-like effect in the lungs, and there's a release of bradykinin, and it has a lot to do with these ACE2 receptors in the lungs for angiotensin converting enzyme 2. So we know that. We also know that the spike protein is really, really infectious. There's mutations on it at the tip, and we know there's an HIV mutation halfway down or so in the cleft that make it very infectious. So we know those things. We also know it's an RNA virus, and we know that as an RNA virus, there's things that can inhibit it. We know that the people getting sick are generally, but not always, older people, heavier people, people with major medical illnesses such as heart disease, diabetes, lung disease, so big time medical illnesses. So that's enough information to start thinking, what are some strategies? Well, since it's a virus, the number one thing is to have your innate immune system ratcheted up, which again gets completely ignored. Hiding in your house doesn't increase your immune system, but taking vitamins, exercising, working out, walking, stopping smoking, and eating better does help your immune system. But the core things, again, are 5,000 of vitamin D, fish oil, melatonin, a multivitamin, and zinc. And you should be on all of those. But I'm going to change the zinc today for the first time in a while, because I got a great article from Dr. Norman Imes, critical care specialist extraordinaire, who's now semi-retired out of Baptist, who turned me on to zinc in the first place. Dr. Imes, and I don't refer to that many doctors as doctor, but he really is a doctor's doctor. I mean, he's a brilliant, gifted clinician who would have done anything for patients, but he was also kind of famous for holding people accountable rather aggressively if they weren't taking great care of patients. So when I was a young doctor and he was at Integris, I was very happy I never encountered him. I had to deal with him because I was afraid, oh God, if I do something wrong, Norman's going to crucify me. And you feel that internal pressure when you have an older doctor who is like the bomb. And I just didn't have critical care patients, so it made sense. But it's been great to know him and learn about everything he knows. But he sent me a great article on zinc. And he's the original person who got me started on the zinc thing without him even knowing it. His current recommendations are, if you've been on the zinc for at least several weeks or a month to 2 months, go to every other day, because your absorptive characteristics change. And so what we want people to do is, if once you've been on it for a month or two, go to every other day. And the standard dose for that would be somewhere around 50 milligrams if you're over 150 pounds. He would just have most people do 50 milligrams. But I think 50 milligrams over 150 pounds, 30 milligrams under 150 pounds. And then if you're starting to be under 100, go to about 15 every other day. Because you've already gotten your alpha interferon up, and you'll maintain that, and you'll maintain a good level of zinc in your system all the time to fight off the virus. Number two, if you get infected with any viral thing, you pulse the zinc, and his new number is 150. So a little bit down for 200. Now, by the same token, if you're a great big person, you're well over 200 pounds, I'd still do the 200. If you're under 200 pounds or 175 pounds, I do the 150. Then you try to get that in incremental doses, whether it's, if you got 20s, you try to do 20 to 40, every hour or two, to get to about 150 or 200, depending on your size. And that's been very steady state for me since February, but this ratchet to every other day will help the absorption and actually increase your overall levels by taking a day off. And it has to do with GI absorption, which gets back to the whole concept about copper deficiency. I've checked innumerable people for copper deficiency just because I have so many people on zinc. We've yet to see one person with copper deficiency. And some of that is your GI tract adjusts your zinc absorption down, so it's very, very difficult to ever get toxic with zinc. And so likewise, if you're eating a balanced diet, you're not going to get low on copper. So that's the core things you want to do. If you get sick, or you could get COVID, you could get influenza right now. We had a patient call today who had a positive COVID and influenza swab. And so that, of course, it causes us some consternation. How do you got to treat, is one a false positive? Are they both false positives? No, because she's sick. But are they true positives? So you have to kind of, get it fixed and do what you can to help that person. I'm a big believer still in Plaquenil. We've had very good results with it. We had another case of people on Plaquenil over the weekend. They made some progress, but again, some lingering lung stuff. So we added doxycycline and dexamethasone. That's our approach, or my approach in my practice. I didn't add the Cipro in this for some particular reasons in this case, but most of the time I do doxycycline and Cipro if I'm going to add an antibiotic instead of the Z-Pak, so then I don't have to worry as much about anything. So, but they both responded immediately to the dexamethasone, which is what we've seen now 5 or 6 times. And again, what did Trump respond to? Dexamethasone, which is really what toned down his infection. And then he got the Regeneron antibody, which of course I can't give you, which is an experimental therapy of a neutralizing antibody that will knock out the virus very quickly. But again, you got to be ready if you get sick to do the zinc stuff. You have to be thinking about the fish oil. There was another case that I was aware of today of a younger person, very healthy, very fit, got COVID, got very sick in their 30s, had multiple pulmonary emboli, thankfully bounced back and survived. But it just illustrates, none of us know our true clotting risks unless we've had full clotting panels. Most of us have not had them. I haven't had one. So, I mean, you only get them pretty much once you've had a blood clot. And so then you can figure out, oh, why did I get the blood clot? And so since there's a lot of clotting abnormalities, being on the fish oil routinely is a great idea. Again, talk to your doctors about or providers about baby aspirin, whether you're a good candidate or not. Again, that's going to be patient to patient, and it's based on males and females and overall health status and things like that. But you have to be doing stuff now. This is going to be the next 2 months at least. The case numbers are going to be very, very impressive. Unfortunately, there's lots of places where people are not getting tested that often. Figure most college campuses, it's pretty low key because none of them want to get their schools shut down. And so if it's running rampant like it has at several universities that many of us have heard of, it's not as well established because the students aren't getting tested. So Kim, what else should I mention tonight? Anything in particular? Other than, hey, we're here, it's here. Take your vitamins, take your zinc, stop smoking, be outside, try to follow the suggestions from the government that make sense to you. Not very many of them make any sense to me, but they're what we have. But we'll go from there. Oh, vaccine update. I think there's currently 15 vaccines in phase 3 trials. There's, I think, 26 vaccines in phase 2 trials, and then a whole bunch more in phase 1 trials. Again, the vaccine data, it's a rush vaccine. And I know this will make some people very unhappy with me to say that rush vaccines are not necessarily your first pick, but they're not your first pick. I personally have had every vaccine you can have. I believe in vaccines. I think vaccines are very important for our overall health. However, I will never be an advocate for a rush vaccine, period. So, and likewise, until they say that if you get COVID, you have immunity, which is the gold standard for immune function, that you've had it, until they say that matters, why would you ever believe then that the immune value of a vaccine matters? Because they have to acknowledge that if you get it, you get some immunity, because they're using neutralizing antibody levels from recovered patients as the marker for success. But they have to acknowledge both, otherwise it's just a racket and they're trying to get everyone to get a vaccine. So you have to say that people who got it have some level of immunity, at least equal or better than any vaccine. And if they're not going to say that, then they're lying. And so that's a huge issue for me as a physician. You can't say, hey, you have to do the vaccine that's based on the neutralizing antibody levels of recovered patients, and say, but those patients don't count. None of that. Those millions of patients who've had it, and the tens of thousands we've checked their levels, and that's what we're basing this on. But they still have to get the vaccine. No, that makes no sense. And so we have to have an even-handed approach that's scientifically valid. So enough of that.
I'll have some questions ready tomorrow.
Okay, we'll have questions tomorrow. I'll have some new publications out tomorrow. I'll have time that I'll just do in a written form. And I should have the official phone number for the study for sure, because it's ready. Okay, good night.